my clinical practice, at the time of diagnosis, we check certain biomarkers. And then over time, when we're following a patient, we continue to check those biomarkers serially. Generally speaking, that's every 6 months. Right now in our practice, there's 3 biomarkers that we continuously follow. Those biomarkers are the serum TTR, or otherwise known as prealbumin level. We set a baseline for the patient before they're started on therapy and follow that biomarker when they're on therapy to measure treatment response. Part of that is because we know that how that level responds to treatment is typically a good indicator about how the patient is going to do on that therapy. And also because it helps the patient understand how the therapy is working for them. This is essentially a pretty concrete thing that you can show the patient and see, look what changed when you started on that, when you started on treatment. We also follow the proBNP. This is a heart stress hormone, and as the amyloid deposits to heart, you make more of this stress hormone. And essentially, we want to stabilize or potentially even decrease this hormone over time. It's almost always elevated when patients are diagnosed. And then there's the high sensitivity troponin, which is a heart injury hormone, which again, as amyloid deposits in the heart, your heart makes more of this injury hormone. We want to stabilize this or potentially even improve it over time. And I always put this in the context of, in the old days before treatment, these biomarkers progressively just worsened. And so this is something clearly that you can show the patients the trends over time.
Indication and important safety information. Indication. Attruby, acoramidis, is indicated for the treatment of cardiomyopathy, of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults to reduce cardiovascular mortality and cardiovascular-related hospitalization. Important safety information. Adverse reactions. Diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.